When you enter a hospital, you expect to be treated. You expect the doctors, the nurses, to have the answers to fix us. But what happens when the system can't keep up? You're told that this is rare, they don't have a protocol, and that you'll just have to wait. It's in those moments that something extraordinary happens. A patient says enough, and a network is formed across chat rooms, kitchen tables, and brainstorming calls. They are no longer waiting for the system. Instead, they plan on changing the system itself. I call them health rebels, patients, caregivers, survivors, and allies who refuse to be passive data points lost in the system. Instead, they become partners and innovators, and they weave safety nets for fellow patients where the system has gaps. I'm here today because I believe that healthcare needs these rebels and that we need to become them because we all live in those nets whether we know it or not. And I believe that in this era of complexity, uncertainty, the greatest resource we have is human connection and shared innovation. So today, let's look at how patients move from being subject to care to co-creators and how that shift matters not only for individuals but for entire systems. This summer, I met one of those rebels in person, Miss Susanna Fox, the former Chief Technology Officer of the U.S. Department of Health and Human Services, also the author of Rebel Health, a field guide to a patient-led revolution. She has spent decades tracking the rise of patient innovators, the citizen scientists and caregivers who push medicine forward from outside in. When I heard her speak, she wasn't echoing the fiery voices of those who wanted to overthrow the healthcare system. In fact, she was doing something much harder. She showed us how patients can reshape it from within, not through protest alone, but rather through partnership. And Ms. Fox told us that she once felt imposter syndrome. She didn't have letters after her name, but after 20 years of listening to people living with rare diseases, she realized something very profound. They often knew more about their own condition than the professionals treating them, as they actually experienced the symptoms themselves. Her advice was simple but profound. When you doubt yourself, stand in your truth, because what you know from lived experience has value, so use it. Traditionally, patients were told that their job is to show up, be compliant, and listen to doctors' orders. They tell you that you are the one receiving care, not the one designing it. But as Ms. Fox writes in Rebel Health, anyone who has fallen off the conveyor belt of mainstream healthcare and into the shadowy corners of illness knows what a dark place it is to land. It's in those shadows that patients began to speak, to connect, and find their own communities. Fox describes 4 archetypes of the patient-led revolution: seekers, networkers, solvers, and champions. Seekers are people who won't stop hunting for answers and diagnoses. Networkers are people who pool resources to create community and say, you are not alone. Solvers are people who build new tools, rigs, and hacks. They say, if nobody will do it, we will. Finally, champions, people who blaze the trail, help scale it, and help policy catch up. When a patient knows what they have lived through, they know just what to ask for. They know where the gaps are. So when you bring in patients as partners and not just subjects, you unlock things that the system can't easily see: the lived experience, invisible work, and peer-to-peer wisdom. It is not enough to say patient-centered. That's still the old model. What we need is patient-led. Fox argues that this shift is radical. Now let's talk about these rebels in action. Picture this: a group of type 1 diabetics, not satisfied, waiting for the industry to build a safe artificial pancreas, who decided we will hack our own continuous glucose monitors. We will build the DIY system. Fox cites this in the Diabetes Rebel Alliance. Another, rare disease communities, people with so little understood that unless they connect, they would never meet someone else who had the same thing. Fox writes in her book, "It was when I realized the importance of connecting online for support and information exchange. That's when I saw the importance of a patient-led movement." They became data collectors, storytellers, and research partners, not because they waited for permission, but because they needed to be heard. And they're not alone. Across the world, patients are turning pain into creativity. Fine art, sound art, visual art, they all become vehicles for a voice. A woman with multiple sclerosis taking her brain scans and turning them into radiant prints of color. An amputee who transforms mobility into motion using dance as activism. A wheelchair user who choreographs in silence. These aren't side stories. They're proof that lived experience is one of the most powerful grounds of innovation we have. We've moved far beyond doctor does and patient follows. We are now in an era of co-creation. The Health Rebel says, let's design think this together. And that's exactly what they do, even if they don't call it that. Emphasize, ideate, define, prototype, and test. They may not have a Stanford D-School badge, but they live that process in every day. When a patient says that they want to build a prosthetic in their garage or design an app to track symptoms, they are doing design thinking in real time. They are asking, what am I experiencing? What is the problem I'm seeing? And if we try this, how can we test it with real people? Traditional healthcare has always been a straight line, researcher to clinician to patients. But in these rebel networks, sometimes that line bends. Sometimes it even loops back. Now it's the patient giving back to their community to make prototypes that feeds it back to the clinician. That flips the flow completely. And honestly, maybe that's what healthcare needs, a little creative reversal, powered by the people it was built to serve. Here's where I want to shift focus, from a single rebel to an entire network, because one patient's innovation is powerful. But an entire web of patients supporting each other will change the entire ecosystem. The metaphor I will use today is safety nets. Traditional healthcare builds these nets for us, but these often have holes. The Health Rebel Network weaves new nets through peer support, shared data, community-built tools, cross-discipline collaboration. When someone says, I know a patient like you, or I built a device and I think that you could use it, you are caught when you fall off the systems ladder. Fox writes, people who share the same disease, stage, or disability can share recommendations about everything, from clinical trials to practical tips for daily life. And the closer we get to the bedside, the more we involve people who are living with the same challenges, the faster progress we will make towards a treatment or an invention and innovation. These nets also democratize power. They say, we bring lived experience expertise, we bring peer knowledge, and we bring insight that does not fit in a textbook. They help fill the delayed feedback gap. When you wait for research, for trials, for approval, peer networks often move much faster through the sharing of knowledge and iterating of prototypes while the formal system catches up. If we believe that patients can lead, first, the system must invite them. Fox argues that for every healthcare organization, every business and government, they all should have insights generated by patients, survivors, and caregivers. However, yes, some of you may be concerned about the risk of misinformation, but as Fox points out, online healthy communities swarm misinformation like it's a virus. So today I ask, what does it take? Number 1, cultural change. Clinicians, policymakers, they must believe that patients are partners. They must believe that innovation can come from the kitchen table or maybe just a foreign thread, not just from the lab bench. We need clarity of role and not hierarchy, as we want partnership and patients to have roles. Providers should have roles. We must clearly assign responsibility and trust. Second, structure and supports. Patient-led networks need infrastructure. They need data access and regulatory pathways for safe spaces. Fox notes how the Black Panther Party in the 1970s collected sickle cell data long before mainstream acknowledgement. We must lower barriers to innovation for non-traditional actors and give them the resources they need. Third, equity and inclusion. Patient innovation shouldn't become the privilege of the tech-savvy, English-speaking, and well-resourced. We must ensure that all voices are woven into the net regardless of race, gender, etc., because otherwise we are still reinforcing inequity. Anonymous patients invent solutions from home, but we must scale so that people, even in remote communities, resource-poor areas, are also caught by these nets we weave. Fourth, data and narrative integration. We must combine quantitative and qualitative narratives. The system often privileges numbers. Patient networks prize stories. We need both. Crisis resource management talks about using all available information. Here, that not only means monitors and labs, but what the patient knows about their own body, their own journey, and their peer network. Fifth, leadership and followership. We have to designate leadership. Attention to mobilize resources and communicate effectively. In patient-led innovation, someone leads and others follow. So today I ask, where do you come in? And where do I come in? If you are a clinician, an entrepreneur, policymaker, or simply a person living your life, I say that there's a place for you in this net. Ask yourself, are you a seeker? Will you raise your hand to ask the uncomfortable question? Will you refuse to accept no data when you've lived the experience? Or are you a networker? Will you say, I will help create the space for others and I will connect the unconnected? Or are you a solver? Will you build something new, whether it's an app, device, process, or prototype? Or are you a champion? Will you amplify the voices, bring resources, and help shift policy? Because the movement beyond data is built by us all. It's patients, providers, designers, storytellers, all weaving the nets together. Because when we do, we catch each other. We raise each other up. So I invite you today to pick your role. Find the person who says, I've been through something like you, and I'm going to share what I've learned. Because in my research and Ms. Fox's, connection is as much treatment as any drug. Thank you.